Okay. Good morning, everyone. Thank you very much for attending my demonstration here. My name is Lieutenant Torres. I'm going to be talking to you guys about ostomy care, okay? So who in here has worked with an ostomy before? All right, awesome stuff. So you know how challenging it can get sometimes taking care of one of these, and keep in mind these ones right here are your picture perfect stomas. You're not always going to get the chance to see them like this, but so you do. Some of these stomas do tend to throw curveballs at you because they're so oddly shaped and everything. But what you want to do is get all of the equipment that you're going to be working with, and some of the equipment that you see here. I'm going to go through all these pieces of equipment, and as I'm also going to be applying them to the stoma as I talk about them. Okay, so bear with me. Well, a little bit of the outline. I'm going to give you some background on ostomies. I'm going to give you the overview of some of these products once again, and then as I'm giving you that overview, demonstrate. Okay. So, sir, what's an ostomy?
An ostomy is an opening, in this case, into the abdomen, into the intestines, so that stool can pass.
Absolutely, absolutely, is absolutely right. So we're looking at colostomies, ileostomies, and urostomies. A colostomy, we're simply doing an artificial opening into the colon. It just depends on where the actual artificial opening is at, whether it's a transverse, ascending, or descending colons, or the ileostomy, which is an opening into the ileum, the ileus, which is going to be the small intestine, and you're going to have more liquid output from that area than you would in actual colostomy. Okay. Then a urostomy, which we don't see very often, but when you do see them, it's basically when the urine is not able to go through the bladder, whether it be because of cancer, bladder cancer, or something like that, or it's not able to go through the urethra. They divert it into one of these urostomies, which is going to again look similar, but they also have their challenges. At the end of the day, the overall goal is to make sure we assess the stoma every day, and that we also protect the healthy skin around that stoma, because as you know, anything that comes out of the intestine tends to have some enzymes that tend to be, digestive enzymes that will give you basically a surface burn around the healthy tissue that you don't want it to happen, because otherwise you'll run into all sorts of other issues. Then you have to actually do some wound care, and you don't want to get to that point. So after we've talked about the ostomy, I want to talk to you guys about the actual products that we have in front of us. Okay. So first off, we have the stoma paste that we have here. Okay. So the stoma paste is you can use it to almost like a caulking. When you actually put the skin barrier down on the stoma itself, that will actually be used to actually fill in some of those areas where the exposed skin is at. Okay. Before we get to this one here, before I apply that one, I want to talk about the stoma powder. So the stoma powder, what's going to happen with the stoma powder is that this actually works to absorb some of the moisture that happens, some of the moisture that you may have around the stoma site itself. So that's what you see there. I'll apply that to that area there. Then with a 4x4, some gauze and everything, you're going to be wiping some of the excess away, okay? So once the excess is wiped off of here, then we can just go on ahead and apply the next piece of equipment here, which is going to be your skin, your non-stain barrier film, okay? And what this is just going to be almost like I want to say like a plastic film on top of the skin to keep protecting that skin. Okay, basically anything that is applied between the skin and whatever else you're putting on top of it, this will prevent any breakdown. So what you do is simply apply it to that side, to the surrounding area here. Okay, like so. Once that's done, give it a little bit of time to dry up, which is not gonna take too much time. But the next thing you want to see is whether you want to apply a ring or not. So a ring, these rings are moldable. You can mold them to whatever shape and size you want. the really neat part about these here, once again, is that as you mold them, get that close to the stoma just to make sure you have the right size. Okay. Keep that going just a little bit longer. Okay. So that looks to be about the size that we want, okay? Right there. So prior to its application, you want to make sure that you're going to have the skin barrier itself, which is the next piece of equipment I want to talk about. These have different sizes. The sizing, you can cut it down to whatever size you want, but some companies actually make this neat little tool here, okay, that tells you how big to cut the actual skin barrier itself. So when we get close by here, we'll see that about a 35 millimeter opening is what we're going to be working with here. So you go back to your skin barrier here. So you can see you got 25, 32, 38, etc. We cut it in between the 32 and 38, which I've already done. We kind of put that against that just to make sure that's going to be the correct size, and we see that it does. I cut it just a little bit bigger, but again, once you have a brand new stoma, the initial inflammation is gonna take over. So you want to make sure you give it just enough room for the inflammation to subside, or if it's going to increase just a little more, whatever the case may be. So once you have that squared away, you put the ring. If you decided to go with the ring, you put the ring in place, like so. Once you get that in there really snug, then it's time for the actual skin barrier itself. Skin barrier, going ahead and take the back off of it. You apply that right on top of that. By the way, use gloves. I'm not using gloves, this is just a demonstration, but use gloves. That was a joke, guys. Come on. And then you slowly peel the backing here. And as you're peeling it away, just make sure you're pushing it down gently. Okay, like so. Okay, so once that's done, again, I put the ring down as a demonstration, but with the ring itself, it's optional. If you have a perfect looking stoma like that, you may not even need the ring because it's actually protruding out of the body enough so that you don't have to worry about that. If it's retracted into the body, then what we can use is one of these that has the convex back to it. What this will do is it will basically dig into the skin to make sure that that you're going to be protecting those areas, the wall around surrounding the stoma itself. And that, so you're not going to have any stool just sitting there, okay? You're going to have this area protecting that wall along with the ring if you want it if you want to do it that way. A lot of the times it's just based upon your imagination, what you think is going to work for that specific stoma, okay? So once we're done with this here, then you're gonna wonder, okay, do I want to use the stoma paste or not? If you want to, you can always caulk. If you want to come and check this out really quick. If you want to go on ahead and fill in that area around it, you can. It's going to be completely up to you to see what the presenting stoma is gonna look like. Okay, again, you don't want to have it. You don't want to like strangulate or anything like that, but you also want to make sure that you're going to be protecting. If there's no open area, if there's no open skin, then you don't have to worry about that. Okay. Last but not least, we have the pouch. The pouch is the one we use, almost like a Velcro system that we have here. You roll it away from you to open it here, just like so, and then you roll it back. Put the Velcro piece right on top. This has a floating flange there. What you do is just simply put this around it, so you're not like pressing down on the patient itself. You're going to be pressing on that piece surrounding the area. Okay. Double check that everything is good to go on the sides. And that is your stoma care. Okay. So This concludes the presentation. This concludes that specific demonstration on ostomy care. What I want to do is take 5-10 minutes to answer any questions and also to have you guys do some hands-on. But then thank you very, very much for attending.